Alright, hi, I'm Justin Merriman. This is going to be my cranial nerve 1 through 12 video, and today is October 23rd, 2014. Hello Arturo, you are my patient. We're going to test your smelling, see how you can smell. I'm going to have you cover one nostril for me, breathe in through the other. Okay, can you do it on the other side too? They sound actually pretty equal. Can I have you close both eyes for me? Cover one nostril. Can I have you breathe in? Okay, can you do the other one? Cover the other nostril. Can you breathe in? Could you smell that equal on both sides?
Yes, sir.
Now what do you think that was? What was the smell? Okay, it was coffee. Good job. This is exactly what it was. You are exactly correct, sir. Alright. Now we're going to do cranial nerve 2. We're going to do a fundoscopic, so I'm going to stick this light in your eye and check the back side of your eye for papilledema, AV nicking, and some hemorrhage. Make sure you don't have any chronic long-standing issues. So I'm going to have you look up to here where my hand is. Keep your head in one place. Just look out here. Okay? Looks good. Same thing. Can I have you look out here for me? Everything seems to be in working order. I'm going to check your cranial nerve 3 for me. So I'm just going to hold out 1, 2, or 5. I want you to tell me what it is. Can I have you cover one eye for me? Okay. What do I have here?
1.
What do I have here?
1.
What do I have here?
5.
What do I have here?
2.
What do I have here?
1.
What do I have here?
5.
Can I have you cover the other eye for me? What do I got here?
1.
What do I got here?
5.
What do I got here?
2.
What do I got here?
2.
What do I got here?
5.
What do I got here?
2.
Perfect. Now we're going to check cranial nerve 2 and 3. We're going to do your bilateral and consensual pupillary dilation. I'm just going to use this light. It's not very bright. I'm just going to have you stare straight ahead. Just checking for constriction of the pupil. Both direct and consensual. Okay, now we'll do pupillary fatigue. We'll just hold it there a little bit longer. Normally it should constrict and not fatigue, which would be trying to dilate. That would be normal. If it did, if it didn't hold its constriction, it would be abnormal. His was fine. Then we're going to have you close your eyes for me. We're just checking for blepharospasms and ptosis. No ptosis or blepharospasms is pretty calm. Good job. We're going to test cranial nerve 3, 4, and 6. I just want you to follow my finger. Can you see it? Okay. Just follow it without moving your head. We're doing the H in space now. Now we're going to go across. Just keep following it. Okay, just checking for nystagmus while you're doing that. Your eyes were actually going pretty smooth, so that's good. Can you see my finger again?
Yes, sir.
Just follow it in towards your nose. Perfect. Convergence looks good. Now we're going to test cranial nerve 5. If I could have you hold out your hand for me. This is basically what this is going to feel like. You feel that? Okay. I'm going to do that on your head in 3 different spots on both sides. I just want you to let me know if it's equal feeling on both sides. Okay? Go ahead and close your eyes for me. Do you feel that and is it equal? You feel that and is it equal?
Yes.
Feel that and is it equal? Good. We're going to do light touch for now. Feel that? Can you feel that?
Yep.
Okay. Same thing on your head. Just let me know if it's equal on both sides. Okay. Equal on both sides. Equal on both sides. Equal on both sides. Okay. Now I'm going to have you clench down your teeth for me. I'm just feeling for the tone of the muscles of mastication. Okay, That's good. And then I'm going to have you go ahead and open your mouth. Okay. I'm just checking for muscle strength, and it was fine. It was pretty strong. Cranial nerve 7, I'm going to have you raise your eyebrows. I'm going to have you close your eyes tight. Okay. I'm going to have you just smile normally and think of something funny today. Good. All right, and then I'm going to have you puff your cheeks out. Perfect. All cranial 7 seems to be intact. Now we're going to check cranial nerve 8, vestibulocochlear. I'm going to have you go ahead and close your eyes. I'm going to have you cover one ear. Can you hear this? Let me know when you can't hear it anymore. Okay. Go ahead and cover your other ear. Same thing. Can you hear this? Let me know when you can't hear it anymore. Okay. Perfect. All right. If he indicated one ear was weaker than the other, I'd perform the Weber test by sounding this tuning fork, sticking on top of the head, figuring out which side it lateralized to. Say it lateralized to the right ear, I would tune it again. I would hold on the mastoid till he didn't hear anymore, then move it in front of his ear and ask him if he heard it. A finding of air conduction longer than bone conduction would be neurosensory loss on the opposite side, and bone conduction louder than or longer than air conduction would be a conduction loss on the side that was being tested. Okay, I'm actually going to test your gait now, so I can have you come up out of the chair. I'm going to have you stand right over here. And just go ahead and keep your eyes open, focus on the wall in front of you. Just walk heel to toe towards me. Really good, really good. Okay, you can stop, turn around. I'm going to have you close your eyes this time, keeping your head up. Do the same thing, heel to toe for me. All right, go ahead and stop. You can have a seat back. A little shaky, but actually a lot better. So now we're going to test cranial nerve 12. Can I have you protrude your tongue out for me? Okay, just checking for fasciculations and equal on both sides. You can go ahead and put your tongue back in. There's one test I needed to run on the cranial nerve 8 still. I'm just going to have you stare across. Don't just keep focusing on the windows out there. I'm just going to slowly turn your head to this side and come back. Okay, now I'm just checking for nystagmus, so just go ahead and stare out there. All right, his eyes seem to be locked on pretty good, no nystagmus. Back to cranial nerve 12, stick your tongue out for me again. Okay, it's equal on both sides, there's no fasciculations. Can I have you protrude your tongue into your cheek like this? Okay, don't let me push in. Other side, don't let me push in. So his muscular strength, cranial nerve 12 is intact. We're going to test cranial nerve 9 and 10 now. I'm going to have you open your mouth, stick your tongue out. I'm just going to have you say ah, 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 ah. Okay, just checking to see the palate raises equal on both sides and yours did, which indicates that it's normal. Then I'm going to have you, I'm going to have to use my handy dandy tongue depressor. I'm going to have you open up your mouth and stick your tongue out one more time for me. I'm going to gag you. You got that? Okay. One more on the other side. Yep. Gag reflex is intact, which is a normal finding. And last but not least, we're going to touch your cranial nerve 12. I'm going to have you raise your traps against my weight. Perfect. I'm going to have you turn your head towards the left. Don't let me bring it in. Okay. Turn your head towards the other side. Don't let me bring it in. Okay. That's my cranial nerve 1 through 12 video, and I'm done.